Welcome to our channel. When we think of common diseases like diabetes, heart disease, or stroke, certain symptoms immediately come to mind, like excessive thirst for diabetes, chest pain for heart attacks, or slurred speech for strokes. However, the human body is incredibly complex, and illness doesn't always present itself in such obvious ways. Many common diseases come with unusual symptoms that can be easy to overlook or mistake for something else. Ignoring these strange signs can lead to delayed diagnosis and treatment, putting your health at risk. In today's video, we'll explore 10 unexpected and often overlooked symptoms of common diseases. Recognizing these early warning signs can make all the difference in getting timely treatment and improving your health. Let's dive in and learn about these unusual symptoms you should never ignore. 1. Metallic taste in the mouth, kidney disease. A rare symptom of kidney disease is a metallic taste lingering in the mouth. That is so because, under normal conditions, the kidneys filter waste and toxins from the blood. However, when a person has kidney disease, kidneys can no longer perform their filtration task, which then allows toxins to build up in the body. This impaired filtration disrupts the patient's waste removal, which causes the touching of taste buds by the waste products, giving either a metallic or ammonia-like taste, a condition known as dysgeusia. This symptom may occur as early as the beginning of kidney disease, and even much earlier than some of its more common signs, such as fatigue and swelling. Other symptoms include loss of appetite, inability to concentrate, and swelling of the ankles or hands. Experiencing these symptoms, especially along with metallic taste, is an indication to meet with a healthcare provider for an evaluation of kidney function. 2. Sudden intense cravings for salt, Addison's disease. It is quite normal to have random salt cravings once in a while for salty snacks, but if you feel an insatiable craving for salt and nothing else constantly, then that should raise concerns about your health. This could be due to a very rare disorder known as Addison's disease, whereby the adrenal glands fail to produce adequate amounts of certain hormones, such as cortisol and aldosterone, thereby creating strong desires to consume salt. Cortisol helps to control blood sugar and blood pressure, while aldosterone works to balance the amount of sodium and potassium. With Addison's disease, when these levels of aldosterone are very low, this may cause a craving for salt because the body attempts to substitute its weakness in this area. Additional signs that one may want to watch for include unexplained weight loss, fatigue and muscle weakness, and low blood pressure, especially upon standing. Since Addison's disease can be fatal if left untreated, one must seek medical attention should unnatural salt cravings occur, among other symptoms. 3. Unexplained hiccups, stroke. Hiccups are not serious and do not last for more than a few minutes. However, persistent hiccups or those that recur with no stop may be an unexpected warning sign of stroke in women. A stroke reduces blood flow to certain parts of the brain. When the part responsible for controlling the diaphragm is involved, then hiccup conditions may arise. While isolated hiccups do not typically show stroke, when accompanied by other stroke symptoms such as sudden confusion and difficulty with speaking, numbness or weakness in parts of the body, as well as very bad headaches, you need to go to the hospital right away. The earlier you're able to catch this disorder, the more likely you are to avoid long-term damage or even death. 4. Itchy skin, liver disease. Generalized itching that is unrelieved with moisturizers or allergy treatments can point to liver disease as the cause. Conditions of hepatitis or cirrhosis, for example, will result in a buildup of bile salts in the bloodstream, resulting in irritation and chronic itching. This is more concerning when generalized and not associated with a rash or evident skin condition. Itchy skin due to liver disease is usually worse at night or during hot exposure. Other possible symptoms include jaundice, yellowing of the skin and eyes, and lethargy, unexplained weight loss. If you experience these symptoms, if at all along with itchy skin, then you must seek a doctor for a liver function test. 5. Burning feet, diabetes. Diabetic neuropathy is a form of damage to the nerves that is induced by long-standing high blood sugar levels, and this may lead to unusual sensations in the extremities. One of the most bizarre symptoms related to diabetes one may encounter is a burning sensation in the feet. Often it's coupled with tingling, numbness, or sharp pain. The feeling of burning may be slight at first, but with more time and continued uncontrolled blood sugar levels, it will only grow in intensity. Other symptoms one can watch out for are as follows: numbness of the hands or feet, weakness in the legs or hands, and loss of balance or coordination. If you are suffering from burning feet or any other symptom of neuropathy, consult a doctor. The earlier you get treated for diabetes or the better you manage your blood sugar level, the less chance you will have to develop more damage to the nerves. 6. Swollen fingers, heart disease. Swelling of the hands or fingers doesn't sound like a serious issue, but if this symptom is accompanied by others, it could be a signal of heart disease. The heart pumps blood to the body, and when this vital organ is not working right, fluid can build up in tissues and cause swelling or edema. This becomes worrisome if the swelling occurs alongside other signs of heart disease, including shortness of breath, chest pain/discomfort, fatigue, or dizziness. If swollen fingers occur for no apparent reason and continually do so, then it is good to see a doctor in such cases to eliminate any cardiovascular diseases. 7. Problems with vision, multiple sclerosis, MS. Blurred vision or double vision, coming on suddenly or temporarily, may be an early warning sign of a chronic autoimmune disease of the central nervous system, known as multiple sclerosis or MS for short. In MS, immune cells attack the protective covering of nerve fibers, which interferes with the communication between the brain and other parts of the body. Optic neuritis, or inflammation of the optic nerve, is often one of the first manifestations of multiple sclerosis. It can cause loss of vision in one eye, pain upon movement of the eyes, blurred or double vision. These symptoms can be temporary, but when they present themselves with symptoms like muscle weakness, numbness, or imbalance, this calls for a neurologist's opinion for further diagnosis. 8. Uncontrollable laughing or crying, neurological disorders. Suddenly experiencing uncontrollable episodes of either laughing or crying for which there is no reason may be indicative of the neurologic condition called pseudobulbar effect. It is somewhat common among people with neurologic disorders, such as multiple sclerosis, ALS, amyotrophic lateral sclerosis, or even those who have had a stroke. PBA arises in the case of damage to the parts of the brain that regulate emotions. The patients suffering from PBA might feel an urgent desire to laugh or cry, at the moments when they are not necessarily in a situation that can be termed as funny or disappointing. The other significant symptoms of neurological disorders that may accompany PBA include loss of muscle strength or muscle spasms, difficulty speaking or swallowing, and numbness or tingling of the extremities. If you or someone close to you experiences these uncontrollable emotional outbursts, you need to consult with a neurologist to ensure that you do not have an underlying neurological problem. 9. Spoon-shaped nails, iron deficiency, anemia. Spoon-shaped nails, medically termed koilonychia, are a rare but enlightening symptom of iron deficiency anemia. This nail softens and thins due to this condition and assumes a concave shape, thus giving it the appearance of a small spoon. Iron deficiency is a condition wherein the body doesn't have enough iron to make adequate hemoglobin protein in red blood cells that enables them to carry oxygen. Other symptoms that may be associated with anemia aside from the spoon-shaped nails include the following: fatigue and weakness, pale or yellowish skin, dizziness, or lightheadedness. In case of changes in the nails, along with other signs and symptoms of anemia, it is best to consult with a health professional who will need to conduct blood tests and deliver necessary treatments. 10. Unusual body odor, hyperthyroidism. Everybody has his or her peculiar body odor, but if your smell drastically changes overnight and gets way worse, this could be one symptom of the weird disease called hyperthyroidism. This is due to a thyroid producing too much thyroid hormone. The thyroid controls your metabolism. An overactive thyroid can rev up your metabolism, leading to increased perspiration. Noticeably different body odor can result from the changes in sweat chemistry emanating from an overactive thyroid. Other symptoms of hyperthyroidism include rapid or irregular heartbeat, unexplained weight loss, and nervousness or irritability. If you experience a sudden change in body odor and have one of these symptoms, you will need to get your thyroid function checked to rule out the possibility of hyperthyroidism. Conclusion: odd or unusual symptoms are easy to become puzzled over, yet they are usually the ways the body attempts to signal an abnormal condition. Being more aware of these unusual signs, you might just pick up a potential problem in time to get treated. Be it an inexplicable craving for salt, a persistent cough, or dark patches of skin, being aware of these weird symptoms could make all the difference in the discovery and management of diseases. Don't ignore your body. Thanks for watching. As we've seen, the body can sometimes signal illness in surprising ways, and being aware of these unusual symptoms could be the key to catching a serious condition early. If you or someone you know experiences any of these unexpected signs, don't hesitate to reach out to a healthcare professional. It could make all the difference. If you found this video helpful, please give it a thumbs up, subscribe for more health tips, and let us know in the comments if there are other health topics you'd like us to cover. Stay informed, stay healthy, and I'll see you in the next video.